A resident with severe arthritis refuses morning grooming. The CNA's best first action is to A. Document the refusal and leave. B. Explain that grooming is mandatory. C. Ask what part of the task feels most difficult today. D. Request another CNA to assist instead. Answer: C. Exploring what part is difficult allows accommodations that maintain dignity and encourage participation. When transferring a resident using a gait belt, the CNA must position the belt A. Over clothing and below the rib cage. B. Directly on the skin above the waist. C. Around the chest for extra support. D. Above the shoulders and under the arms. Answer: A. A gait belt is always applied over clothing at the waist to prevent injury and increase control. A resident begins coughing forcefully while eating. The CNA should first A. Perform abdominal thrusts. B. Encourage them to keep coughing. C. Call a code blue. D. Insert fingers to remove food. Answer: B. A strong cough means partial obstruction, and coughing is the safest way to clear the airway. The most accurate way to measure fluid intake for a resident who drank from multiple cups is to A. Estimate visually. B. Ask the resident for their best guess. C. Measure each container's remaining fluid. D. Record only full cups consumed. Answer: C. Calculating intake requires measuring what remains to determine the exact amount consumed. A resident with dementia repeatedly packs belongings as if preparing to leave. The CNA should A. Confiscate the items. B. Redirect with a meaningful activity. C. Remind them they are confused. D. Ask why they are behaving strangely. Answer: B. Redirection preserves dignity and reduces anxiety without confrontation. When cleaning a catheter drainage bag, the CNA must A. Raise the bag above bladder level. B. Disconnect tubing from catheter. C. Keep the system closed and clean the spout. D. Flush the catheter internally. Answer: C. Closed drainage systems must remain intact, only the spout is clean to prevent infection. A resident on fall precautions wants to walk alone. The best CNA response is to A. Firmly deny permission. B. Notify the nurse immediately. C. Offer to walk with the resident now. D. Pretend to allow it but follow secretly. Answer: C. Supporting independence while ensuring safety is the most therapeutic approach. After removing gloves, the CNA notices a tear in one glove. The correct action is to A. Ignore it and continue care. B. Remove gloves and wash hands immediately. C. Double glove next time. D. Report to housekeeping. Answer: B. Any glove breach requires immediate hand hygiene to prevent contamination. A resident begins to have a tonic-clonic seizure. The CNA should first A. Restrain limbs from shaking. B. Insert a tongue depressor. C. Move objects away to prevent injury. D. Hold the resident upright. Answer: C. Safety comes first by clearing surroundings. Restraints and objects in the mouth are dangerous. When assisting with oral hygiene for a resident on oxygen therapy, the CNA should avoid A. Using water. B. Using petroleum-based lip moisturizers. C. Offering a soft toothbrush. D. Removing dentures if soiled. Answer: B. Petroleum products increase fire risk when oxygen is in use. A resident on strict INO vomits after drinking 120 milliliters of water. The CNA should record A. 120 milliliters intake only. B. 120 milliliters output only. C. Both 120 milliliters intake and emesis as output. D. Nothing, since it was not absorbed. Answer: C. Intake is still recorded, and vomiting counts as output. When repositioning a resident on a pressure-reducing mattress, the CNA must A. Skip repositioning since mattress prevents sores. B. Reposition every 2 hours. C. Reposition only if the nurse orders it. D. Wait for physical therapy. Answer, B. Pressure-reducing devices do not replace scheduled repositioning. A resident reports new numbness in their right hand. The CNA should A. Massage the hand firmly. B. Encourage movement. C. Report immediately to the nurse. D. Apply ice to the hand. Answer, C. Sudden numbness may indicate circulatory or neurological changes requiring nurse assessment. A resident's call light is repeatedly going unanswered due to staff busyness. The CNA's best action is to A. Pull the call light from the wall. B. Inform the charge nurse promptly. C. Tell resident to wait patiently. D. Ignore non-urgent requests. Answer, B. Failure to answer call lights is a safety issue that must be escalated. The CNA can help prevent aspiration during meals by A. Allowing the resident to eat lying flat. B. Encouraging talking while chewing. C. Ensuring upright position at 75 to 90 degrees. D. Offering large bites for quicker eating. Answer, C. Upright posture minimizes risk of food entering the airway. A resident with limited vision wants independence during meals. The CNA should A. Describe the plate using the clock method. B. Feed the resident to avoid spills. C. Move food randomly to test awareness. D. Remove utensils. Answer, A. The clock method supports independence by orienting the resident to food placement. When weighing a resident daily, consistency requires A. Using any available scale. B. Weighing at different times for accuracy. C. Weighing at the same time, same clothing. D. Allowing resident to choose when. Answer, C. Consistent conditions give reliable weight trends. A CNA notices a coworker speaking harshly to a resident. The CNA should A. Pretend not to hear. B. Report the behavior immediately. C. Join in to calm the resident. D. Threaten to expose the coworker. Answer, B. Abuse must be reported immediately per federal and Alabama guidelines. When assisting with range of motion (ROM) exercises, the CNA should A. Move joints until the resident feels pain. B. Stop if the resident complains of discomfort. C. Move quickly to finish faster. D. Stretch beyond natural limits. Answer, B. Pain indicates potential injury, ROM must be slow and gentle. A resident on oxygen is found with the tubing kinked. The CNA's first action is to A. Remove the oxygen. B. Straighten the tubing and check flow. C. Change the oxygen tank. D. Turn up the oxygen rate. Answer, B. Always check for simple causes before adjusting equipment. A resident who is usually calm becomes suddenly aggressive. The CNA should first A. Stand very close to control them. B. Step back and ensure safety. C. Physically restrain them. D. Leave them alone in the room. Answer, B. Safety and maintaining space prevents escalation. Proper perineal care for a female resident includes A. Cleaning from back to front. B. Cleaning side to side. C. Cleaning front to back. D. Cleaning only if visibly soiled. Answer, C. Front to back motion prevents bacterial spread from rectal area to urethra. A resident with a new hearing aid states voices sound distorted. The CNA should A. Turn up the volume to maximum. B. Remove and clean the device. C. Tell the resident to ignore it. D. Replace the battery without reporting. Answer, B. Cleaning solves common issues, changes must be reported for further evaluation. When measuring blood pressure, the CNA must A. Inflate the cuff until the resident complains. B. Use any cuff size for convenience. C. Use a properly sized cuff on bare skin. D. Take BP over clothing to maintain modesty. Answer, C. Incorrect cuff size or placement leads to inaccurate reading. A resident complains that their roommate is taking items from their drawer. The CNA should A. Dismiss the concern. B. Mediate directly between residents. C. Report the concern to the nurse. D. Hide the items elsewhere. Answer, C. Suspicious activity or conflict requires nurse involvement. A resident requires thickened liquids but is handed regular water by a visitor. The CNA should A. Allow it since visitors are exempt. B. Inform the visitor and provide thickened liquid. C. Scold the visitor. D. Hide the resident's drinks. Answer, B. Education maintains safety and prevents aspiration. A resident with new edema has shoes that no longer fit. The CNA should A. Force the shoes on carefully. B. Switch to slippers without reporting. C. Report swelling to the nurse immediately. D. Ignore swelling unless painful. Answer, C. Edema may signal fluid retention or cardiac issues. A resident refuses a scheduled bath but has strong body odor. The CNA should A. Threaten consequences. B. Offer alternative hygiene options. C. Ignore the odor. D. Bathe them quickly without permission. Answer, B. Respect for autonomy includes offering alternatives like a partial bath. A CNA overhears a resident revealing very personal medical information to another resident. The CNA should A. Publicly correct them. B. Tell others about the conversation. C. Remind the resident privately about privacy. D. Ignore because they shared it voluntarily. Answer, C. Gentle reminders support HIPAA awareness without violating privacy. While assisting a resident to stand, their knees buckle suddenly. The CNA should A. Push the resident back up forcefully. B. Yell for help immediately. C. Ease them to the floor safely. D. Try to keep them upright at all costs. Answer, C. Controlled lowering prevents injury to both the resident and CNA.